6, 5, 4, 3, 2, 1.
Hi, and welcome to this week's episode of Hello Health. My name is Alex Sampson. I'm going to be your host today, and today I'm actually going to be interviewing Dr. Letitia Anderson. She is actually a doctor of cardiology at Northern Nevada Medical Group. Before I get into Dr. Anderson's speech, I have been getting a lot of questions about what is Hello Health, why are we putting these YouTube live videos together, what's the point of all this? So our main goal as an organization is to connect people with doctors. And so we do that through a couple different ways, through the health insurance plans that we offer, through these live presentations we're putting on through YouTube Live, and through the in-person seminars that we have. And so this kind of furthers that goal of connecting people to health insurance. So my name is Alex Sampson. I'm with Health Benefits Associates. We have offices here in Reno, Sparks, and in Carson City, and we're trying to get the word out about these doctors that we're interviewing on this Hello Health video series. So we're also putting together another video series called Mastering Medicare. The first episode is going to be on September 15th. This is going to be more focused away from the doctors and more on the different Medicare plans. So basically how to get to those doctors. And so that's the main goal of these presentations. And I also feel like in Northern Nevada especially, there's been a huge misconception regarding provider availability. And so a lot of people, even clients of my own, think that they need to go down to Sacramento or to Southern California to go get a primary care doctor office visit. I think that that's not necessary, to be honest with you. I also think that when you find a good doctor, when anybody finds a good doctor, they become the best kept secret that you have. So no one wants to tell anybody else about good doctors here in town because there's a huge misconception that they won't be able to get enough care, enough treatment or whatever from that doctor moving forward. I don't think that's necessarily the case. So I've been trying to introduce doctors like Dr. Anderson coming up here in just a minute and really trying to showcase all that Northern Nevada has to offer regarding healthcare and health services. So one final housekeeping note before we talk to Dr. Anderson. We're going to use this, we're doing this on YouTube Live actually, so no room for mistakes here, but there is a comment section here on YouTube, and we're going to use that comment section upcoming here for any Q&A afterwards. So Dr. Anderson is going to speak, and then we're actually going to be shifting through the Q&A section to answer any questions that you have for the doctor, and so I'll be asking those to her. If we don't get to your question, I want to be really respectful of her time, so if we don't get there, I will do my best to get those questions answered and back to you. And if I don't, please email me. My contact information is on the website, and I definitely want to hear from you and hear what questions you have. So without any more breaks, let me get Dr. Anderson's info here. So Dr. Anderson completed her residency and fellowship at Brown University and the University of Vermont. She moved here from New England in 2007. Since then, she's been working full-time as a cardiologist here in Nevada. That's actually a really interesting point because when you get to the level of expertise that Dr. Anderson has, a lot of the time the upper management notices that and they want you pushing paper instead of seeing patients. Dr. Anderson has actually made it a point to actually see patients and not become some administrative, make that a barrier, let's say. Since she transitioned to her new job last year, she will be the new chief of staff of the Northern Nevada Sierra Medical Center. That's extremely impressive. And in case you don't know where that is, that's a new hospital that they're building on the corner of Longley and Double R. So it's just still being built. It's supposed to be finished in March of 2022. And so without any more talk from me, I'm going to turn it over here to Dr. Anderson. Please.
Thank you, Alex. I hope everyone out there is doing well, and thanks for the introduction. I'm very grateful to be here. This is a great opportunity, and please, my time is not the issue. It's all of you guys' time who's here watching live or maybe later. Um, I'm over at the hospital today, so if I have an emergency, I have my cell phone. But other than that, my time is yours. And I love the way you guys talked about our patients, like you did, the words of health. We're not talking about diseases here. We're talking about prevention and health because that's what this is all about. And being able to access your doctors, your providers, your teams. Gosh, I call my hairstylist for an appointment and I get an answering machine. So I can't imagine how it is for all of us to try to get in touch with our providers. And I have some tips and tricks. I think we have some new tools with our patient portals and being able to talk to our patients over the computers and on the phones. We'll get there. But yes, very excited about the new hospital in town. We're looking forward to it. I think, in terms of healthcare here, we're getting bigger by the minute. You guys both grew up here, I think, a lot of you guys, and maybe everybody on YouTube. It's much needed. This is the first hospital system being built here in the last 100 years. We need this. The word is out, not only about good doctors in town, but about Reno being an awesome place to live, like all of Northern Nevada. So our hope in the new hospital system is that we keep our grassroots Northern Nevada principles like we all have here in Northern Nevada, but be inclusive and open, not only for our beautiful, awesome patients to stay well and keep their chronic diseases out of trouble, but also to our providers. So I appreciate you guys so much for including us. You are going to make this better and better by taking care of our patients and being there for them. So without further ado, I'll roll to my talk. Did he have questions or no? We'll keep going. So I'm here to talk about something called hypertension today. Hypertension means in English high blood pressure. I had a young kid ask me that the other day when I was talking to his mom, and I thought, geez, I wonder why we just don't call it high blood pressure. That would be a lot easier. So I would talk about what hypertension is, kind of like what we do with it, how to manage it, and what are things to worry about or think about, and what do we need? How do we keep that access with our providers? How do we keep out of trouble? What does hypertension mean to your heart and other organs in our bodies? And how do we stay healthy? So a short history, hypertension is just a definition of blood pressure from the heart. The blood pressure from the heart, the pressure the heart exerts on the stream of blood constantly chaining through your body is elevated. So what? Like, who cares? Why do we know about this? Well, up until about 1970, when most of you guys hopefully were alive, and a lot of maybe the younger viewers were not, we didn't know what blood pressure was. We had no idea. We didn't treat it. And a first trial came out in about 1971 saying diastolic blood pressure, the lower number, the top is called systolic and the lower is diastolic. They realized that that number being above 90 seemed to track with people dying. Dying from what? Not really sure, but we did see that that number, diastolic blood pressure being high, tracked with mortality. It wasn't until about 20 years later when another trial came out called the SHEP trial all across the world that people started to realize that management, like actually treating people with medicine, very small medicines, a diuretic, made an impact on mortality. It was earth shattering. And that was 1990, like I was in high school. So, long story short, this is new stuff. It kind of makes you think when I see patients every day as a specialist that come in talking to me in granular detail about how they're nervous about their blood pressure, or how they understand inherently that it's a risk for stroke and heart attack. So unbelievable when you think about that. 20 years ago, we are just starting to understand that high blood pressure on the bottom number and on the top number have a direct impact on death and wellness and heart disease and stroke. Um, yeah, one thing that I thought, and please feel free, Alex, to interrupt if you need questions but listen to this. Do you remember FDR, Franklin Delano Roosevelt? 1940, well, he had polio, so he was in a wheelchair, but he also had horrible blood pressure, right? Nobody really knew what it was, but they knew how to take it. Back in like the 1800s, we invented fancy versions of my prop here, which is called a blood pressure cuff or a sphygmomanometer. That means Signal means pulse, so it's a way of tracking the pulse and measuring it. Manometer is a pulse, is a measurement. So FDR went to his checkup before his second term in about 1940, And his personal doctor said, this doctor is in the best health. Of course, they didn't tell anybody about the wheelchair business, but they did say he's doing great. And we have it, it's at the National Archives in DC, if you're ever there. They have his physical exam clearing him. And guess what his blood pressure was? Let's just give you a shout out. Normal blood pressure is like less than 130 over 80. FDR's blood pressure going into his second term, 220 over 160. Yeah. So just saying, that was a long time ago. We won World War II, but holy mackerel, right? So that was that. And I just thought that was a neat aside saying, this is all new. And to why, moving to why, well, okay, I know what blood pressure is. I know the history. We know it causes death, but why and how do we know how to get our hands around this? American Heart Association, what they started telling us about 10 or 15 years ago, to people like me who was on their board for several years, here in town, they say things like, hey, Letitia, Dr. Anderson, just make sure people know, make sure they're aware of what? That high blood pressure is a risk for heart attack and stroke. And you say, well, that's silly. Like, so I'm at the supermarket and someone says, hey, do you know what blood pressure is? Do you know what high blood pressure is? If that patient says, yes, I do, I understand that high blood pressure is blood pressure readings above the national recommended goals. And yes, I understand that that will impact my wellness and even my mortality. That patient will live longer and do better than a patient that says, I don't know. So knowledge, not only of hypertension for all of you guys watching this, but of any disease state, or basically like wearing your seatbelt or brushing your teeth, knowledge of a problem in your health merits better outcomes without even an intervention. So if there's one thing you realize today by watching this video, and thanks to Alex and his team, by understanding risks to your health and wellness, it makes you already ahead of the game, even if you don't do anything. So that's point number one. The AHA knows that. They call it Life Simple 7. And Life Simple 7 is kind of, I have it on my phone because I forget sometimes, but they're the 7 things in our lives on a day-to-day basis that are essentially preventable or at least treatable and manageable that make a difference on heart disease and stroke. Hypertension is one of them. So knowing and even treating high blood pressure as a medical condition can impact your wellness and your heart health. Diabetes, obesity, smoking cigarettes, those are all some of them. I guess like getting gray hair and aging and our family history, often we can't change that. But just for you to know, Life Simple 7 and knowledge are our best back pocket technique for preventing heart disease. So that's kind of what I really wanted you to understand before we leap into kind of common questions for me are usually, well, what are the goals? I'm on 2 medicines. I sometimes call that a rabbit hole. If you're up here on the airplane with us and you're saying hypertension is a common condition, 70 million people or more in the United States have blood pressure that should be managed better. Maybe I'm one of them, but at least I know. And yes, back to Alex's point, I want to be a person that can reach out to either my insurance portal, I can reach out to my MA or my doctor, or maybe I have a specialist, somebody on the other end of a connection, be it my computer, be it my phone, be it my neighbor who is a EMT or somebody that I can talk to as a community when I have questions. Because having questions unanswered, we learned this with COVID. We learned this with a pandemic. Being isolated escalates issues. It escalates our problems all over our body, mentally and physically. So those are my preliminary tips and kind of where, how, why, and what. I couldn't do this talk, I don't think, as I look at my clock without kind of saying how and why. So I have a blood pressure cuff. I promised myself I wouldn't even touch it because I thought that would make people kind of not feel like they're participating. People that know they have elevated blood pressure readings, and by our national guidelines, depending on the patient's profile, can range anywhere from less than blood pressure readings. Normal blood pressure readings should be less than 120 over 80. A patient's profile means who am I and what disease states do I have and what risks for heart disease and stroke do I have? What age am I? What problems do I have in my medical history? Based on those patients, we typically like to keep blood pressure less than, once they've been diagnosed with hypertension, less than certain numbers. Let's say for my patients, sometimes it's less than 130 over 70. For patients that might have had open heart or vascular surgeries, it might be less than that. for healthy younger people without other medical conditions, we might be more generous. But the first treatment is knowledge. So sometimes we'll say, hey, go to the Apple store or go to Amazon.com or some server like that and buy your own thing. Own it, right? Isn't that what the kids say nowadays? Do what you like to do, but take responsibility. So learn how to check your blood pressure. There are very easy ways to do it. Any medical assistant can help you with that. Um, I know my husband would watch a YouTube video to do it. So, kind of sit in a quiet place, uncross your legs, keep a beautiful diary, be honest with yourself. I'll tell patients that come in and say, I only have high blood pressure when I'm nervous. You say, well then, Mr. Smith, I want to hear how often you're nervous or in pain or vulnerable or angry or all of these things are real. When my dog runs away, that doesn't make me happy. But if my blood pressure is consistently high during these times, you might need to pay attention. So having feedback and constant two-way streets of getting your blood pressure checked and following with your provider, great thing to do remotely. I wouldn't want my patients to wait 6 months to see me to give me 6 months of blood pressure readings. I'd like quick follow-up via the portal back and forth saying, hey, try this or try this. National guidelines are always going to say we should do interventions with wellness, health, diet, exercise, and knowledge base for 6 to 12 months before we try medications. This isn't going to be, for most of us, meeting a doctor with high blood pressure readings and getting sent home on a medicine, and that's it. This is going to be an interactive interface. Blood pressure is definitely manageable. Blood pressure is a big leading problem in the cause of people like me dealing with people because it causes heart disease. So please, work with us. Love to see you here because I know you guys have already won the game. The fact that you're here and obtaining knowledge and having curiosity about your health means you're going to do very well. So please do us all a favor, and you guys serve as ambassadors to the rest of us out there that haven't. So reach out to a friend today and talk about blood pressure. So that's kind of my intro. I'm here for you guys to ask questions and answer questions. So I'm going to pass it back to you, Alex, to find out what our next steps are.
Perfect. Awesome. Thank you so much. And that was thank you for that presentation. There were, I hate to not get to the questions right away, but I actually have a personal question. I hope it's okay if I ask one of my own. I had a close friend of mine actually get diagnosed and have to go into open heart surgery in the same week. And so it was just a shocking revelation. As somebody you would never suspect. They completely were hauling bags of sand in the week before from the truck over to the garage, and you would have thought, oh no, there's no way this guy has the blood pressure. And so it did come up immediately. And so thank you so much for some of that guidance, some of those preventable steps. I understand what you're saying, where there are preventable and treatable steps, and then there are those genetic steps. And so you can control what you can control, just like you said, own it, like the kids say. Gosh, that was some great advice. So without any more delay here, we did get some questions from a couple different people. Here's one from Nancy here. I have hypertension. Is heart disease determined by genetics?
Great question, Nancy. I think both of those things are true. Is hypertension determined by genetics? Yes, it can be. And the stew of our beautiful American population, what's genetics and what is just kind of how I grew up, maybe some of us have obesity, some of us have diabetes, we don't know. So yes, genetics and hypertension are very closely related, particularly if you're diagnosed at a younger age. We say less than 40. A healthy young person with blood pressure diagnosed less than 40, we strongly think about hypertension being genetic. Good question. This is a funny aside because I love funny asides. Hypertension in general comes in two types. One is called essential hypertension. The other is called secondary hypertension. And look, if you guys could help me make up new names, that would be awesome, because essential hypertension was named that way before any of these trials I was telling you about, because people legitimately thought before 1970, this is people like me, doctors, that some blood pressure was essential. You just needed to have it. And it was too bad, like FDR, sorry, that's just who you are. So goodness gracious. So there was a big push years ago to call it primary hypertension, but unfortunately, people decided to leave it essential. And so for people like Nancy that have primary hypertension perhaps, and there's nothing causing it like thyroid disease or other other non-cardiac issues, they're called essential hypertension. So it's not essential at all. You should still treat it. But yes, there's no genetic test we run today, but talking to your family and getting that dialogue going, mom and dad have hypertension, you have a pretty good chance of developing it yourself even at a later age. Good question, Nan.
I do have one question here about the new hospital. I heard there's going to be a new hospital in Northern Nevada, Northern Nevada Medical Center. So I think that they're asking, what kind of role are you playing in that new hospital? You said you're the chief of staff.
Oh yeah, it's really exciting, you guys. So the UHS is the parent system of the health system that's beginning here now, called the Northern Nevada Health System. That hospital is called Sierra Medical Center. The hospital up in Sparks is called Northern Nevada Medical Center. They're both beautiful places. Oh my gosh, the new hospital is exquisite. If you get a chance to drive by, it is absolutely gorgeous. Up to 200 beds. They're all single. The focus will be on patient care, open policies, inclusivity, treating all patients like they're somebody special. Sometimes we get away from that. I think this is the time. I think we're coming out of COVID. I'm really hoping that we're all coming out. So beautiful thing. Our community needs this. There's all sorts of good feelings associated with it. It's definitely the reason I'm here, to make that happen. As chief of staff, I'm grateful to be here in this position. I certainly am going to be working full time as a cardiologist because I couldn't live without doing that. I spend a lot of my time in the rural clinics, going to Winnemucca and Fallon and Northern California. We have to do this, you guys. This is what it's all about. So lots of people in this community know that. So thank you. That's a good question. Drive by and say hi.
Awesome, yeah, and you talked a little bit about the rural clinics, and we've been expanding our office into the rurals as well, and it's not rural anymore. If you get down south of Carson, it's actually pretty busy down in Minden Gardenville, that area, and even just South Carson, it's just booming down there. So. Yeah, absolutely, but it's I think it is a forgotten problem, and I should have said this from the very beginning. I believe that heart disease is the #1 killer of Americans today. I think that we talked about this a little bit before, but is that still the case today?
100%. Yeah, heart disease has been the leading killer of people, and we look at it, in generations. But if we look at people that live to 85, if we take that type of a person, for sure, 2/3 of us that make it to age 65 will die from heart disease.
Wow.
Scary thing, last year with the pandemic, all of a sudden, COVID was the second biggest killer in people over the age of 65. So that's, thank God. Well, I don't want to say thank God it's heart disease again, but the crazy thing is, and again, tattoo this on your forehead, if you walk away from this meeting, you should remember 80% or more of heart disease is completely preventable. This is not cancer. This is not like a genetic, malfunction that you're going to die from. If we know about these things, your friend Alex and all of the people that I meet, almost all of them, will tell you, if I had only checked with a doctor. My common one when I see a patient, I say, did you know about this? They said, no, I've never had a problem before. And you say, well, when was the last time you checked or found out about it? Long time. So all of us, be preventative, learn these things. Heart disease can be eradicated just like we did with polio. So help us out.
Good. Well, I've got a kind of important question here. Well, all of them are important. And by the way, if I'm not getting to your question, I guarantee you I will go through the questions afterwards and do my best to get to them. But I have one here. If you're on medication for other health issues and that medication affects blood pressure measurements, is it possible that medication is likely to cause problems with your heart as a side effect?
That's a great question. So thank you. So the question was, can medications for non-heart problems affect blood pressure up or down? And if it does, well, is it going to cause other problems? So here's the thing. I hope my goofy little analogy helps. If I'm sitting in my house and I have an arrow going through my head and my blood pressure is super high, and I say, well, it's just this arrow going through my head, that heart and these organs, including the brain and the kidneys, is still feeling that high blood pressure. So they don't care if it's an arrow or whatever, you've got to get it down. And to his or her question in particular, If I'm on medicines for something, let's say it's cancer or something really like a big deal, or just my feeling better, and it's working, let's work around that. If it's causing a problem, like the blood pressure is too high or it's too low, work with your providers. Call me, text me, say, hey, Letitia, my blood pressure is too high, but I'm working on this medicine and it's awesome for me. I'm doing great. Well, let's work on it. Yes, we might have to do some intervention to make you right. Same with too low. If your blood pressure is too low, there's some medicines, for example, for Parkinson's disease that can really make your blood pressure low. But if you're doing great and living with your family and your life is going great, please let's make it work. We can come out on the other side together. So again, back to Alex's question, connectivity, making sure your health team is understanding and together. Good
Perfect.
question.
Well, I'm getting a couple of questions that are right in the same area, and so excuse me if I summarize a little bit here. But at the new hospital, will you be accepting new patients or scheduling new appointments, or how do people go about that? That's a three-part question.
Okay, let's do this. Three parts. So yes, yes, and I'm not exactly sure. So I will always, I better put my hand on the Bible or something, but I will always see new patients. I will always be there for whoever. Um, uh, that is what I went to school for. I have a badge for seeing
Perfect.
patients. Even. So, and yes, I'm available throughout this community. I'm available in the rurals. My office number, should I share it, or is that something that's like offline? Um, I better,
We'll actually we'll share all of your contact information in the comment
here.
section below.
Yeah.
We'll put all of that in there, and how to schedule an appointment. We'll include all of that in the YouTube video in the comment section.
Yeah. And on a shout out, there are so many great cardiologists in town. If you're out of network or whatever, all of my friends, I think there's 34 cardiologists in this town. There's like 140 in Vegas. All of us are great colleagues. I have so much good things to say about Northern Nevada, not the hospital system, but the community being a great place to get heart treatment. So a shout out
Absolutely.
to all my friends.
And if it's a network issue, I mean, that's why we're here with the other half of the health insurance coverage. If it is a network issue, we want to make sure that if we can't fix it today, that sometime before the next plan effective date, that thing gets fixed. And so, without a doubt, I'm here to make sure that that network issue is not an issue for seeing you.
Okay.
Yeah. And so, for some of the other questions, I think we're getting pretty close. Hold on, I had one more here that was pretty good. Oh, if you know somebody that got a stent instead of getting open heart surgery, is the
Mhm.
stent better or worse, or what's the difference, or why would somebody do one over the other? Is that something, you know, is that something that people usually have? I'm not familiar.
Yeah. And you get a heart doctor starting, we'll start talking about history, right? So stents are awesome. Stents are like little mesh tubes that you put inside these tiny 2 to 3 millimeter arteries to open them to clear out, basically mash away the plaque and platelet buildup that has happened because of the risk factors we were talking about. Um, and so you can open arteries with many different things. The two most commonest are stents or balloon angioplasty. So what we do, our interventional cardiologists do this, or opening the chest and bypassing, using veins from the legs, the arteries in the chest or the wrist to bypass the arteries that are too blocked.
Got it. Perfect.
In 2021, there are reasons to do one or the other. The kind of simple way to look at it is a stent is kind of like one and done. Great. I had a beautiful young man yesterday. He was a healthy guy. He got a stent because he had one artery blocked. He was having a heart attack. In and out. The guy was fixed up through his radial artery in about, Dr. Trong did it in about 30 minutes. If he had significant blockages in all three of his major arteries, or it was in a very difficult location that he couldn't put a stent, yes, he would warrant open heart surgery based on national guidelines. So we still utilize both of those things. One is not better than the other. There's some people who can't get either procedure, and we find that some patients with coronary disease do quite well with just medical therapy. Medical therapy is very potent. So controlling risk factors like hypertension and doing medical therapy alone, in the last 5 to 10 years, we've realized that that is an excellent way to manage coronary disease. So stents and open heart, CABG, we call it, coronary artery bypass surgery, are great ways to manage coronary disease.
Perfect. Well, we're approaching kind of the 40-minute mark here. So, Dr. Anderson, I wanted to thank you so much for this Q&A, for this opportunity to have you come on, speak a little bit about high blood pressure, hypertension, risk factors, and everything that you discussed. I couldn't even pretend to summarize it. It was just so much good information. Thank you. And again, we'll include her contact information below for anyone who's interested in scheduling an appointment with Dr. Anderson or any of the cardiologists with the Northern Nevada Medical Group. So thank you so much for being on.
Thank you, Alex, and your team, and thanks to everyone who took time to take care of yourselves. We're here for you, okay? Have a great one.
And I've got one last thing for everybody just before we sign off here. If you thought this video was helpful, please make sure to like the video. It really helps us out, improve the communication to Northern Nevadans about different doctors that are available. If I didn't get to your questions, if we didn't get to your questions in time, I definitely want to make sure that we get to those. So please don't be afraid to still leave those comments, still leave those questions. I'm going to go through them, make sure they get answered. So for the links in the description below. So we're also going to include links to the future seminar series coming up called Mastering Medicare. I talked about that a little bit at the beginning, but that starts September 15th, and so that's coming up. Our next Hello Health presentation, Grant Dodge will be presenting Dr. Dennis Patterson on July 28th. That'll be a week from today at the same time. So thank you so much for tuning in, and we hope you have a great day. I'm Alex Sampson with Health Benefits Associates.